Okay, so we're talking about two concepts this evening. That's what is known as what chemotherapy cystitis, then hemorrhagic cystitis. So the thing is this, alright? Chemotherapy can cause the bladder to become inflamed. Do you understand? But sometimes it's not a must that it might bring out blood. Do you understand? But sometimes it can cause it to bring out blood. Now, sometimes the bladder could become inflamed of various other things that could cause it to now bleed. So you'll be passing out what? Blood in urine. That one where you're just passing out blood is a hemorrhagic cystitis. But mind you that chemotherapy can actually cause hemorrhagic cystitis. You get? So that chemotherapy cystitis and what hemorrhagic cystitis are actually type of cystitis that's inflammation of the gallbladder. The bladder, just the bladder like that. So for the chemotherapy is caused by some certain chemotherapy drugs like what? Cyclophosphamide, ifosfamide, alright. These ones actually irritate the bladder lining. So they now cause what? Your bladder to be bleeding out blood, bleeding out blood, bleeding out blood. You understand? So causes could be due to what? Irritation from chemotherapy drugs, which I have listed. Okay, acrolein, ifosfamide, cyclophosphamide, right? Sometimes it could be inflammation from different things. Okay, sorry. They also cause inflammation. So urethral cells in the bladder become inflamed, leading to a discomfort. Okay. Symptoms is painful urination, that's dysuria, frequent urination, urinary urgency, and incontinence. Then urinating in blood, that's blood in urine, hematuria, and bladder pain and discomfort. Okay. So for hemorrhagic cystitis now, this one is characterized by what? There's inflammation, there's bleeding. Okay. So chemotherapy can also cause this one. Radiation therapy can also cause this one. Do you understand? That's why I wanted to like discuss them together. Okay. So chemotherapy, there's cyclophosphamide, ifosfamide, radiation therapy too. Okay. Which will often affect the pelvis, which can lead to damage, ulceration, scarring, bleeding in the bladder lining. Infections too. So exposure to some infections like bacterial infection, viral infections, all of this can actually what? Cause hemorrhagic cystitis. Okay. So symptoms is hematuria. Okay, so be passing out blood in urine. Coming. Presence of blood clots in urine, dysuria. Okay. Coming. Then what again? There's urinary frequency. Okay. Then bladder pain and discomfort. There's fever in some severe cases. Alright. So this is it. So diagnosis is mainly what? Urinalysis, cystoscopy, imaging studies like what? CT scan, MRI. Okay. Treatment, basically hydration, use antibiotics if you are dealing with bacteria, then hyperbaric oxygen therapy, antioxidants, surgical interventions. Okay. So this for the two types of what? This cystitis.